We're here outside St Thomas's Hospital, where junior doctors are currently taking their fourth round of industrial action. We've spoken to junior doctors about why they're striking, as well as striking healthcare workers with Unite.
Junior doctors in this country have had 15 years of consecutive real terms pay cut, to a total of nearly 30%, if not more than 30% real terms pay cut over 15 years since 2008. We're not worth a third less than we were in 2008. We work incredibly hard. These are doctors who make life and death decisions, who are on nights, on weekends, looking after patients with strokes, with heart attacks. Really emergency care is being provided by people who are on as little as £14 an hour, and we just don't think that's acceptable.
We've had a 5% pay rise imposed on us by the government, but our union Unite has rejected that, and we're continuing to strike to show our opposition to that. But also we're trying to highlight just how bad conditions are in the NHS at the moment. We're effectively having an all-round, the winter crisis is now all year round. Every week we're having, with the hospital, at least 1 day or 2 days a week is on red or black alert with not enough beds for patients. We've still got ambulances queuing up to get into A&E. We don't have enough beds to see patients and admit patients safely. We've got a queue of patients every morning out the entrance from A&E, and it's not safe. We employ a paramedic to go and check that queue, because that queue can be 20 or 30 people long. People can take an hour or two to queue up to be booked in. In that time, we've been pulling people out of that queue who are extremely unwell, who are septic, who are potentially having heart attacks, and we're having to try and identify them while we're trying to manage everyone in the office. It's not how it's meant to work. We're meant to have enough beds to admit people. We're meant to have enough staff to book people in quickly, and we just don't have the resource to manage, and it's making it so unsafe. It's incredibly stressful. We're asking our staff every day to manage huge levels of risk that we just can't do safely, and it's unimaginable levels of stress for people, and it's burning people out, and they are leaving in huge numbers, and all of this is causing harm, it's causing distress, and it's entirely avoidable if the government actually funded the NHS properly.
The problem is that the government just doesn't respect us. They don't value us. Doctors start on about £14 an hour, and they're signalling that they're going to cut our pay further. Doctors have been working on goodwill for many, many years, not least through the pandemic. And the government failed to protect us during the pandemic with inadequate PPE, inadequate resourcing, and they threw us to the wolves of a virus we knew nothing about. And then afterwards, they've left us out to dry in the cost of living crisis. They don't care about us, and we've got to stand up for ourselves and say enough is enough.
And so, obviously, the government have imposed a real terms pay cut on other healthcare professionals. And I want to know whether you think the government have come to the negotiating table with a realistic offer so far.
No, they haven't, not at all. And what's really frustrating, and one of the reasons why this particular round of action is happening, is because the government's precondition to negotiations is that there are no strikes on the table, which means as soon as our last round had finished, by their own rules, they should have been back round the negotiation table and settling this, like the Scottish government has, but they didn't. They didn't even send any correspondence to us, and that's why we had to call for further strike action.
And what would your message be to the government?
The government needs to recognise that without doctors, there is no health service. And that is also true of other healthcare professionals as well. We all work together, and we're pulling the healthcare system up and out of the waters because it's a sinking ship. And that's on the back of goodwill. But goodwill has been expended. There's none left. And they owe us a great debt. It's time they pay us back.
How long have you worked in the NHS?
12 years.
And have you seen it get worse in that time?
Yeah, I think so. I mean, I've changed jobs in that time, so obviously I've seen it from sort of being, very much on the ground to being sort of slightly higher up, and I just feel like we're being squeezed and squeezed and squeezed. It used to be we felt quite protected in the NHS. I think now, you're just constantly worried about what's going to happen, and also, my job, if I make a mistake, people could die, if I get a dose wrong, people could die, and it's just working under that level of stress and just the expectation that you can keep going and keep going and keep going. People keep leaving, you have to train the new people, and it's just really horrible, and it's really difficult to steady the ship.
What do you think of the government's response to strikes within the NHS have been?
I think it's been appalling. I think this whole government's been appalling in pretty much everything they've done. I haven't really seen a single good thing that they've done. I think it's disrespectful. I think it just shows their complete contempt for ordinary people, for working people, not just for the staff here, but I think for people who use the NHS. I think it treats people like they're idiots, of like they don't understand, like saying that we don't have enough money for it when they have plenty of money for all of their glory projects that they want to complete. You know, this is an essential service. We need these services. How can you have a functioning society when, you know, people can't be seen for ordinary problems? People getting cancer treatment, you know, they talk a lot about trying to improve delays. If you're not putting the funding in, then you can't improve anything.
This is the fourth round of action. You're taking, 5 days of strike. It's the longest strike in NHS history. How does that feel?
It feels disappointing, really, in the fact that why should we need to continue to strike just to bring the government to the table? The government haven't met with us in months, yet we've been going on with monthly strike action. And it seems that the government are just trying to wait us out, to try and see if we, give up striking. But we're not. We're determined as a profession to stand up for ourselves, to stand up for the NHS and the country as well.
Do you feel respected by the government? Do you feel like the government values the work that you and your colleagues do?
No, not at all. Not at all. It's all lip service, and it really doesn't matter which Conservative MP comes in as the new health minister or whatever. It's all lip service. They can promise whatever they want, but we don't see it. I think the goal is to privatise it, and that's what they're doing. They're stripping the NHS of everything, and yeah, they're going to sell it off. That's my personal view,
So I've worked in the NHS for about 20 years now, and it's just got steadily worse and worse and worse and worse. There's been a massive encroachment of private sector into the NHS, where all the NHS, all different bits of the NHS have been hived off into a sort of competition with each other, where it's very difficult to work across services. It's much harder than it used to be. The staffing levels have gone down and down and down, either through direct cutting of posts, or just often just allowing wastage. So someone leaves, you just don't fill the post, and people just have to expand their workload to cover what there is to do, and that's again across all sectors. And it's got to the point where every day feels unsafe, and every day feel like you're just chasing your tail from the beginning of the day to the end. And it's got to stop. We've got to kind of stop it at some point, because I think this government is utterly determined. They don't like the NHS, they don't agree with the NHS, they want to be able to make a profit out of healthcare, and that means that everybody is unsafe.
What kind of emotional toll does it have on you and your colleagues not being able to do the job as well as you want to?
It becomes that you start to feel that you're just literally ticking boxes to do your best to keep people safe, but it doesn't feel like a quality service. I know, I don't know. It feels unsafe. It feels like you're just waiting for something terrible to happen, and you don't quite know where that will be. Because there's so many, particularly in terms of things like children's safeguarding. Sometimes when you've got a big emergency case that comes in, like all the eyes are on it, that's maybe less of a worry. But it's the little ones, the children that we don't see, where there's the little clues to what's going on with them, and we're just terrified about missing it and something awful happening. And because we don't have enough staff, we don't have enough time, we don't have enough resources, and then they will all be all over the papers going, oh, this is terrible, it must never happen again, just like they always do. And every single time it comes back with the same recommendations about what we need, which is, more people, more health visitors, more nurses, more resources, more family services, and they just don't exist. They never have existed. And every time we win them, they take them back as soon as the media pressure has gone, because fundamentally they don't care. I think, unfortunately, which is a sad thing to say.